I am Craig Peevyhouse. I'm the Director of the Emergency Department, Henry County Medical Center in Paris, Tennessee. Last year, our ER saw almost 20,000 people. At this time, we're seeing about 55 to 60 patients every day. Many of these patients have life-threatening conditions, while others have conditions that are not life-threatening, but still need to be seen in the emergency room. As we see patients, we see them according to the severity of their illness or their injury. We use a process called triage. We have specially trained nurses that will examine you and determine whether you're sick, sicker, or sickest. That is one of the reasons that when you come in and someone else comes in behind you, that you may have to wait a little while they go ahead of you. It's not because we're favoring them, but it's because they're sicker or may become sicker quickly if we don't do something immediately. So that is the reason that you might see someone else come into the ER and go ahead of you. One of the most frequently asked questions is, when do I need to go to the emergency room? Or when do I need to see my primary care doctor? First, with any life-threatening emergency, with anything that is severe that you deem to be a severe emergency, always call 911. Our EMS service has specially trained paramedics that can take care of you and treat you, and they also have constant contact with the physician at the ER. So always call 911 and get an ambulance on the way if you have a life-threatening emergency or something very severe. I want to share with you some life-threatening emergencies that require you to come into the emergency room. Any chest pain, discomfort in the chest area, it may feel like an elephant standing on your chest. It may be some discomfort. It may feel like indigestion. In any of those situations, please call 911 and have EMS come and bring you into the hospital. Other problems are breathing difficulties, anytime you're short of breath for no reason. Stroke symptoms would be one-sided weakness, slurred speech, dizziness, and some other things, sudden onset of paralysis. Also severe abdominal pain, especially after some type of injury. Uncontrolled bleeding always needs to have the attention of the emergency room. Blunt head trauma, where you lose consciousness, also needs to come in. Actually, anytime you lose consciousness for any reason, you need to be seen by an emergency room doctor. Any neck injuries from an accident, whether it be a fall or a motor vehicle accident or an ATV accident, those need to be seen in the emergency room. Poisoning or suspected drug overdose also would require emergency room services. Being bitten, it's spring, so being bitten by a poisonous or venomous snake and or spider requires an emergency room trip. One thing about the snakes, do not kill the snake and bring it with you. We would just rather treat you. Another thing is serious burns or cuts. Anytime you have a seizure, especially in the onset of seizures, you need to come see an emergency room doctor. Broken bones, especially those where the bone might protrude from the skin. If you have thoughts of harming yourself or harming others, please come see us. We want to take care of you and take care of what might be bothering you. Open wounds, knife wounds, any gunshot wound requires a trip to the emergency room. But what about those times that you need to see maybe just a family physician? If you have a cold, minor flu-like symptoms, some coughing, things like that where you're not short of breath. Chronic conditions require the attention of a family physician. Prescription refills. The ER typically does not do any prescription refills. That is left up to your family physician. Ear infections, minor sprains and strains, urinary tract infections, low-grade fevers, upset stomachs, sore throats, coughs, skin rashes, bug bites. Those things can be seen by your family physician. If you will call your physician, they will usually get you in quickly or as soon as they can. We also have some convenient care centers located in Paris that would also be willing to see you. Don't forget, If you have an emergency, always call 911. We enjoy your business at Henry County Medical Center, especially in the ER. We want to take care of all of your emergency needs. We're going to do it as quickly and as efficiently as we can. Thank you and have a great day.